Hi, everybody. It's Mrs. Bartels. I'm going to finish up the lecture for this week on chapter 24. It's just one lecture for today. This will be Thursday's tape lecture, and it is 10 slides. Chapter 24 talks about fluids. So 23 was all about nutrition needs. Now we're going to talk about the fluid needs of a person. So fluid balance is needed for health. We need to make sure that the amount of fluids going in our body is coming out of our body, that they are equal and they're balanced. So that means, like, if I give a patient 3 liters IV fluid, I need to make sure that that fluid goes in for the body uses what it needs to use, and then the rest of it, and it comes out. So if you are giving your patients, say, 6 cups of water, we have to make sure that they're getting 6 cups of urine out. So that's what we're talking about. We're talking about balance, okay? The amount of fluid taken in is intake, and the amount of fluid lost is output. They have to be equal at the end of our shifts, okay? So again, the fluid that we take in is called intake. The fluid that comes out of our body, meaning urine, vomit, blood, any drainage, the things that we can measure that comes out of the body in liquid form, is an output. So we've already done intake and output in class, so I'm not going to spend a lot of time explaining that to you. Edema is when the body has too much fluid and the body starts to swell. So if we give a person a lot of water and then they're not urinating it back out, they can start to swell up. That's called edema, where the tissues swell. Dehydration is when the person is losing fluid and we're not replacing the fluid that's being lost. So they're losing a lot of fluid and they're not taking it back in. So maybe somebody is very sick and they're vomiting and they have a lot of diarrhea and they cannot take fluid in. They cannot drink. They cannot swallow, because every time they do, they vomit it back up. Okay, so that's dehydration. If dehydration happens, usually we have to start an IV on a patient. The average adult needs 1,500 mLs of water to survive daily, but in order for us to be balanced and adequate, we need 2,000 to 2,500. So 2 to 2.5 liters is what is needed for normal fluid balance, okay? If we have 1.5 liters, we'll survive, but it's really not enough. We need 2,000 to 2,500 for good fluid balance. Make sure you know those numbers. They show up on state, and one of them will also show up on your test or your quiz this week. Okay, so 1,500 to survive, 2,000 to 2,500 for normal balance. And of course, you probably already know this, that your water requirements increase when things around you, your environment increases. So if it's hot outside, we need more water. If we have a fever, we need more water. If we exercise, we need more water, because the heat, our body temperature is going up, so our body requests more or needs more water. To maintain a fluid balance, the doctor may order the amount of fluid a person can have in 24 hours. So a doctor might decide, hey, we need to make sure that this patient doesn't have too much fluid going in or too much fluid coming out. So he might order intake and outputs. He might tell us to keep track of how much the patient's taking in, how much the patient's taking out. He also might order special diet orders like these. One would be to encourage the fluids. So basically we'll say general diet, encourage oral fluids, meaning he wants the person he wants the nurses to encourage the person to drink as much as possible. Okay, so you're going to offer fluids often, especially if the person cannot reach for the fluids or get the fluids themselves. You're going to keep going in there and offering them, here's some water. Do you want it? If they don't like water, you're going to offer them juice. Find out what they like. Push those fluids. Get those fluids going. So encourage or push fluids means he wants, however we can get fluid into the patient, he wants you to get fluid into the patients. Restrict fluids means that we can only have a certain amount of fluids per shift. So if somebody's on a restrict fluids, it's usually because they're having heart or kidney problems. And the doctor will say the patient can only have maybe, 300 mLs per shift in oral fluid. Well, then we have to know that, and that includes what's on their dietary trays. So we have to work with the dietitian and the nurses to make sure that we're not giving the patient too much fluid. He's getting exactly what the doctor ordered. Nothing by mouth means they cannot eat or drink anything. And thickened liquids, we talked about in the prior chapter. Okay, so you guys know about that. Intake and output, again, I'm not going to spend a lot of time on it because we've been doing it in class and we will continue to do it in class. The best way to learn intake and output is do your intake and output worksheets and get in the lab with Mrs. Kalberg and start looking at intakes and outputs and the samples that she has out and calculating. This is all math, you guys. It's teaching you through Zoom is not going to work, or through like a recorded lecture. This is stuff you need to get involved in. So you need to be in class on the day you're supposed to be there and doing this. We always document in mLs. So everything will be in ounces because that's how America measures things. But we have to take those ounces and convert them to mLs. So just remember that 1 ounce equals 30 mLs. So the patient has 3 ounces. I'm going to take 30 times 3. 90 mLs is what they have. If the patient has 1 ounce, she has 30 mLs. Okay, so you just have to know how to multiply by 30, and you should be able to figure out your mLs. Okay, and the problem then becomes, did the patient eat it all or not? So maybe they had a 4 ounce, say this is a 4 ounce thing of milk. So 4 times 30 is 120, but they only had half of it. So now I'm going to have to know how to figure out what they had. You divide by 2. Okay, and again, well, this stuff we're learning in class. Output is measured using cylinders or graduates. Here's an example of a graduate, and basically the big marking on it, we always look at mLs. Remember, mLs is where you look. Don't ever look at anything else. So mLs, if you look, every big line is 100. So 100, 200, 300, 400, 500. Every little line in between is 50. And then these look like they're 10 hash marks. So this would be like 110, 120, 130, 140, 150, 160, 170, 180, 190, 200. Okay. So again, it's kind of like reading a ruler. Okay. And we measure intake and output. So if output can be, as you see it up here, urine, vomit, diarrhea, wound drainage, or drainage from suction. People use urinals, a commode, or a bedpan to void in. Remind the person not to put the toilet paper into whatever they're voiding in. So if you have them using a urinal, tell them not to put toilet paper in the urinal. If they're using a specie pan, like it's a woman and they're urinating into the toilet and the pan is catching it, tell them to not drop the tissue into the toilet, because you don't want the tissue paper or the toilet paper mixed with your urine output. Measuring output, again, here's a urinal. We'll have these out in the lab and you guys can look at them and you're going to learn how to measure. When you measure urinals, this one here, it's every hash mark, large hash mark is 100. Every medium hash mark is 50, and then the little ones are 25. So this is 300, 325, 350, 375, 400. Okay. When you measure any output, you have to make sure it's on a flat surface and you're squatting at eye level. So you're equal at eye level to the container. So you're measuring and not looking down on the container. There's a picture of that on page 352 of your book. Okay. So you understand. And again, it's stuff that we're going to be doing in the lab. Drinking water. So how can you guys help a person meet their fluid needs? Well, you can't give IVs. You can't give feeding tubes, but you can provide fluid by oral, so drinking. So drinking water is a huge way that you can make sure that your person is getting enough fluids in. And you provide fresh drinking water each shift and whenever the mug is empty. So when you're filling the water pitchers, you're taking them out. Make sure you do not touch the rim or the inside of the cup. So you don't want to touch the cup or the inside of the cup. Make sure the cup is clean. Don't ever touch the tip of the straw. If you're giving a new straw, the best way to do it is just give them either a straw that's not opened, or open the straw, but leave the paper on the tip where they would put it to their mouth and let them take the paper off. Always put ice inside the pitcher first and then add the water. Never let the ice scoop touch the inside of the cup or the inside of the pitcher. And don't ever leave the ice scoop laying inside the bucket of ice. You want to leave it on the side, okay? So it's easy to find if you don't have to go sticking your hands and digging around and contaminating that water. Make sure you date and time the cup so we know what time it was given. So if it's been more than 8 hours or more than one shift, we need to get rid of it and give them fresh. If somebody's on aspiration precautions, make sure that they don't have a straw, or check with the nurse before giving them a straw, because most of the time people on aspiration precautions cannot have straws. So the best thing to do is not to give them a straw, or check with your nurse if you're unsure, because they might tell you I can have it. You still check with the nurse. If they're on fluid restrictions, do not give them a water pitcher. Do not leave a cup in the room. Don't leave straws in the room. Don't leave anything they can drink out of in the room, because they can always go to the bathroom if you have a cup and get water from the tap or from the sink. And if they're on fluid restrictions, they can only have what is allowed. So they cannot have free access to water pitchers and cups and stuff so they can go to the sink. Okay. IV therapy. So I, as a nurse, can do an IV. So if my patient's not getting enough fluid in, we could try pushing it by doing oral fluids, like we were talking about, encouraging the fluid, giving them lots of water to drink or any kind of fluid they like to get the fluids in. Another way we could do it, though, is we could replace fluids using an IV. So an IV is giving fluids from a needle or a catheter that's inserted into a vein. A nurse has to insert the IV, or a doctor. It cannot be a CNA. I cannot start an IV without a doctor's order. The doctor needs to tell me the amount of fluid that I'm going to give. So how much am I going to put in? How much am I going to infuse? And he needs to tell me the amount of time he wants me to give it over. So does he want me to give one bag of IV fluids over 8 hours? Does he want me to give one bag of fluid over 4 hours? He needs to tell me the amount that I need to give it over. So he needs to tell me what I'm giving and how much I'm giving and the time. The RN figures out the flow rate. So if he says, I want you to give 1 liter of IV fluid over 8 hours, I know that 1 liter is 1,000. 1,000 divided by 8 is 125. So my rate is 125. That's all stuff that the nurse does. And you guys will learn that as you become nurses. Okay, so the nurse figures out the flow rate. The doctor gives the order, the nurse figures out the flow rate and starts the IV. What can you do with IVs? You can't do much, but you can be a set of eyes that's very important for the nurse. So what you can do is you could look at the drip chamber, which is what this nurse is doing in this picture. She's got a watch in her hand and she's looking at this chamber right here, and she should see a drip, a drip, a drip. So if I was your nurse and I told you my drip rate or my flow rate is 60 drops per minute, you could take your watch like she is, and you could watch the drops come through the drip chamber here and count for a full minute. Is it 60? Okay, so you could do a flow rate check for me. And then if it's, say it's supposed to be 60, but you count 80, that's going too fast, you're going to let me know. Say it's supposed to be 60 and you count 40, it's going too slow, you're going to let me know. If you're looking in this chamber and you're not seeing any dripping, no dripping's happening, you're going to let the nurse know. Okay. If you look at the bag and the bag is almost empty, meaning it's only got like maybe this much from this down, you're going to let the nurse know. So when it's about, 1/4 is left, it's 25% is all that's left, let the nurse know. Okay. If the patient complains of pain at the IV site, let the nurse know. If there's bleeding, if there's redness or swelling at the IV site, let the nurse know. Or the IV or this area around the IV is blue or cold to touch, let the nurse know. You can never start an IV. You cannot change the bags in IV or maintain the IV, meaning if you think it's running too slow, you can't speed up the rate. If you think it's going too fast, you can't slow down the rate. That's all nursing. You can't do any of that. You can't change out the bag. Maybe I'm busy and you want to be a great CNA and put a new bag up. You cannot do that because you don't know what's in those bags. So the nurse has to do that. And you can never give any drugs or blood for the bag. Well, that's for the IV also. And that is it. We are done with the chapter.